morning, Illini. Welcome back to another Healthy Illini podcast. I am your host, as always, Matt Schrock, and we are past spring break. So we're on the downhill slide of the semester, and we're glad you're here. We're glad you're listening. Hope you're doing well. Hope your semester's going well. And today we're going to talk about a topic that's a little bit more general, but one we really haven't hit specifically on Healthy Illini, so I'm excited about this one. Today I'm joined by three guests. Two are staff here at McKinley. We have Carrie Atkinson. She is an APRN here with our Women's Health Unit. Carrie, thanks for being here.
Thank you.
We're also joined by Christy Higgs. She is also an APRN, but CNM is her official title, and she's also with our Women's Health Unit here at McKinley. Christy, thanks for joining us as well. And then we have a student voice with us today, Bailey Berry. She is a junior in communication. She's also on staff here as a student worker at McKinley. She is our social media coordinator for our marketing department. And Bailey, thanks for joining us. Okay, so we talk a lot on Healthy Illini about general health and wellness topics, but today we're kind of drilling down on a specific topic related to students at the University of Illinois, Urbana-Champaign. A lot of times we talk about things that can be of interest to anyone. This one is of interest to anyone, but we're going to specifically talk about it here on our campus, so there is a little bit of that slant to it. McKinley Health Center, where we all work, is the only university-affiliated medical center here at the University of Illinois, and we offer a whole host of resources and different units and different things that students can take advantage of. And one of those resources is our Women's Health Unit. And as I said, Carrie and Christy both work out of that. So let's start there. For a student coming to our campus, it may be the first time they're taking responsibility of their own healthcare. Maybe the first time they're stepping out from mom and dad's watch, from the physician or the provider they've known their entire life, they may have grown up with in their area, and they're stepping into something new. And that can be a little daunting at times. And hearing women's health is a good thing, but it may not mean that much just in general, just a general term. So let's start there. What does Women's Health Unit mean here at McKinley, and what services can be found there?
Well, women's health is available for, as you said, all the students for, specific women's health needs where they can come for screening exams for sexually transmitted diseases, for pap smears, to get birth control, infection checks. We also we do IUDs. Christy actually inserts a lot of IUDs. We do colposcopy if someone were to have an abnormal pap. We do just general visits if somebody has some concerns or, just wants to talk about specific things related to women's health.
So it's not necessarily that you need to come to the area that you should think about coming and speaking to someone at the unit because there's an issue. It can also be just for informative or for I just have a general question, or I don't know about this particular part of my own personal health, or I've heard these things, I want to talk to somebody. Those are all valid reasons to come in.
Correct.
One thing you did mention that I do want to have you share a little bit about is the different types of birth control. Because you said birth control, but that can mean a number of different things depending on the person, on their health, on their preference, that sort of idea. So what are the different options as far as birth control that the Women's Health Unit has in McKinley?
So oral contraceptive pills are offered, and we have a fairly decent selection of the variety of types. Not every single type on the market, but the pharmacy does a good job on keeping current. And so they can be prescribed here at minimal or no cost, or prescription can be written to take outside pharmacy. So pills, the injection, the Depo-Provera injection, the implant in the form of IUDs. We have the 3 different progesterone-containing IUDs, barrier methods, diaphragm, condoms, emergency contraceptives.
We also carry dental dams that they can get at the health resource room and condoms that they can come in any of the hours that we're open. They can get so many a semester, so they just come into our front desk where it says health resource desk to get condoms, dental dams, pregnancy tests, yeast medication. There's also a vending machine that's over at Iconberry Commons, and we're looking at getting more vending machines around the university. And there are some other health resource centers at some of the cultural centers. If you look on our website, it'll talk about certain hours that those are open. So that's kind of nice. Someone can just walk in and get those as needed.
So I have a couple questions for you guys about birth control. Firstly, I'm wondering if you decide that you want to get started on birth control, how do you go about starting that process, as well as, since there are so many options, how do you suggest students go about picking one over the other?
Well, we do have an online birth control education class that we really encourage everyone to do the same way with that. You get on our website, go to the Women's Health, and there's an online birth control education class. There's also an online IUD class. So that just kind of talks about all the different methods of birth control. When I see a patient, a lot of times a question that I will get is what I would recommend for them to take. And generally I say, well, that's something we can talk together about, but it's something that you would need to come up with. What's best in your life? Are you going to be able to take a pill the same time every day? Or is it a situation where you don't want anybody to know that you're taking, the birth control pills? So maybe an IUD would be better, or the Depo-Provera. And sometimes there can be some health limitations for certain types of birth control also.
We have an appointment, what can be scheduled online, called Birth Control Consult. And the idea behind that is to get people in quickly, review a health history, review options, and then kind of collaboratory work on what would be best for them. That you can come without the need for a physical exam. So you can get started with a conversation.
So you guys talked about emergency contraception. So I was wondering, could you go a little bit more in depth in what that means?
Sure. So if someone has unprotected intercourse, which means that, they did not use any type of birth control, did not take their birth control correctly, and are worried about becoming pregnant, there are emergency contraceptions. The one we have right now is called My Way. There's lots of different names. It used to be called Plan B. And the best time is to come in within 72 hours of the unprotected intercourse to get the emergency contraception. So students can come into the pharmacy. They don't have to come up to Women's Health to get the emergency contraception. There's no cost the first time. There are small charges if you get it more than once a semester. There is also something called Ella, which some of the research talks about maybe the decreased effectiveness of the emergency contraception if someone's BMI, if their weight is a certain weight, if their BMI is over 30, that Ella would be better, and it's up to 120 hours after. Right now, Ella is not over the counter, so if they were interested in that, they would come up to the Women's Health Department to talk to someone about that.
This comes back to something that we're passionate about here at McKinley, but that students may not necessarily be aware of, is that we don't want to just be the health center that you come to when there's a problem or after the fact. That you're trying to mitigate an issue. We are very passionate about the idea of educating, and women's health is one of those areas that is really important to educate students about health, about agency of healthcare and things like that. Why is that so important to your unit to try and educate students as to the things you do, but also how to approach this type of healthcare?
Well, I think, as you said in the beginning, one of the more difficult transition for some young adults is they're taking responsibility now. They're calling, they're doing an online appointment. They're coming alone, typically without a guardian. You can bring someone with you if you need to, or if that would be helpful for you. But to take the initiative and to show up as a consumer of healthcare is a big step. They have to answer all the questions and not have a parent or a guardian to answer when they're asked by a provider. And they have to learn to make decisions independently. Sometimes they have to learn to say yes or no instead of this is what we're going to do. So that agency, that learning, the system, learning about choice, learning about responsibility is a huge step.
And it's okay to not know answers.
Yes.
That's big. Because I know even myself, and I'm in my 40s now, and I go to the doctor with my kids and they ask me a question. So I go, okay, that's my question I was prepared for or I hadn't thought about. And it makes me feel like almost like I'm doing a bad job. And I'm not. I just didn't know the question. And so especially for somebody who's stepping into the first time they're taking care of their own health, that it's okay to go and get asked a question and say, I'm not really sure. And that we're here to help guide through that then and say, okay, so now we move into this. And it's not a judgmental, it's not a, we're going to slap a label on you that, bad patient, something like that. We're here to try and help walk through that. And women's health is no different because you're stepping into different, as your body matures, as your body changes, even for the rest of your life, any person who's listening, there's going to be moments where you're confronted with something that you never had to think about before as you go. And so that's part of learning how to be a good consumer. That's part of what you all do.
Yeah, and I think something that I've also seen is we'll ask if you've had the human papillomavirus vaccine, which helps prevent against genital warts, and which is the most common reason for abnormal paps. And the student will be like, I don't know, and I say, no, that's fine, because you got those. A lot of times vaccines when you were, 10 and 13 years old, mom or dad just took you just got them, and and then we explain to them what they were for and, why they got them, or if they didn't get them, what they should. So, yeah, we want to ask the questions, but we never judge. If somebody doesn't know the answer, we kind of help them navigate, and I'll say, oh, I can look and see here you did have them. It is in the record, and it's great that you had them. If you hadn't had them, we do have them available here at McKinley.
You both had informed decisions is one of the things that you're passionate about, helping students have informed decisions. And you don't know what you don't know. So until you come in and start asking the questions or talk to somebody, you have no idea. So part of that informed decision is getting informed, and that's what we're here for. So the next step I wanted to go into is kind of in line with what really we want to do at Healthy Illini is take a situation and make it relatable, make it something that you can grasp onto. Say, yeah, I can do that. And the idea of going to any provider can be really daunting. And so let's take a visit to the women's health and try and make it a little bit more understandable. So what does that mean? If somebody comes in and they want to be seen at women's health, what's the process to get there? What does that look like? Just kind of walk me through what a general visit would be like.
So the process to open a visit would be the same as anywhere else in the visit. So kiosks at the entryway. And then women's health is on the second floor. You're checked in there. Vital signs are taken. If you have an annual exam or a well-woman exam, there's a paper form to fill out for health history. And then you're put in the room with the provider. And then depending on what your needs are, sometimes you're undressed partially, sometimes you're completely clothed. Sometimes it's a conversation about what would come next if you deferred a physical exam today. So there's a lot of history-taking questions initially, and then typically a physical exam, and that's almost always followed by education. I think we have a nice access for patient education that goes through the portal. There's posters on the wall that we use for anatomy. There's a lot of education for birth control options, charts and things that are simple. And then leaving is usually straight out the door unless you need a follow-up appointment. If you need to go to the pharmacy, it's down the steps. And if you need to go to the lab, it's down 2 flights of steps, which is a good way to get exercise, which I always end my visits with.
There you go. And initially, we do have online scheduling. We do have online scheduling for, it'll say, if you're having vaginal symptoms, if you want sexually transmitted infection screening or birth control consults. If it falls outside of that or you're not really sure, most of the time we would prefer that you call to schedule an appointment because we want to get you in with the correct provider. Like I said, for example, IUDs right now, I've done IUDs in the past before. I'm not doing them right now. I'm the administrative nurse practitioner for the floor, but Christy and then Dr. Ambrose do IUDs. If you've had an abnormal pap smear, then Dr. Ambrose does colposcopies, but sometimes you might need a little bit more time than just that visit. But if you do make a visit, sometimes we do need to say, hey, we can do this for you today, and then let's get you set up for what we can do for you the next time. But generally, we're going to address your needs that day.
You mentioned a test as part of one of the services you provide. Can you go over a little bit more of what an STI testing appointment would look like?
Mm-hmm. So generally, we follow the Center for Disease Control guidelines. They recommend that anyone under the age of 26 gets routine screening for chlamydia and gonorrhea. But we always ask, if someone comes in and they don't want to do that, or when someone comes in to see me for a sexually transmitted disease screening, I'll ask them, what is your concern about it? Sometimes they're concerned about maybe herpes. Sometimes they can be concerned about genital warts. But generally, there's no really routine screening for herpes. Same way with genital warts, you can visually look to see. So usually it's chlamydia, gonorrhea screening, and hepatitis C, they say, once in your lifetime. And then also syphilis screening and those can be done. The chlamydia and gonorrhea can be urine, or they can be a vaginal culture that we take. The syphilis and the hepatitis C are generally blood tests. So it kind of depends on what, they're most concerned about. And, sometimes maybe someone's been exposed and, we'll talk about, was your partner, positive for something. And if they were positive, generally we're going to go ahead and treat them, still do the testing, but treat them for that sexually transmitted infection.
So I'm also curious, how often do you recommend a student to come in for women's health visits? How often should they follow up as regards to STI testings or as well as just general checkups?
It's a great question. We classically follow the annual, recommend to come once a year for an annual checkup. That tends to be wellness-based. You can certainly come in with symptoms with an annual visit. Sometimes I save up all mine and dump them at the annual. So annual means once a year. And then any other time in the semester or the academic year that you have a GYN concern. That could be a breast problem. It could be irregular periods. It could be vaginal discharge. Anything that impacts the body as a female.
I'm also curious because we did touch on preventative measures. I recently turned 21 and I haven't gone for my first gynecologist visit, and I was always told growing up that 21 was the recommended age. So I'm curious, what do you guys think is the best time to go to your first gynecologist visit, and what are the things that you can expect during that first visit?
So if you're from a wellness perspective, the annual visit, we can do annual visits obviously at any year. 21 is the magic for the PAP test, cervical cancer screening. That can be done at any point from 21 on. But we can see 18, 19, 20-year-olds. Sometimes a pelvic is done, sometimes it's not. That kind of depends on the preference of the student, the medical indications, and then a collaborative agreement on what's best at the time.
So some of these health concerns like STI testing, emergency contraceptive, birth control, some of these are real personal to students, and some of them may be concerned about privacy issues regarding such as their parents finding out. So can you guys touch on how you guys handle the confidentiality of these concerns?
Right. So over the age of 12 in the state of Illinois, you can seek care for contraception or other visits, women's health related. So here, at McKinley, if someone comes in, everything is confidential. We don't release anything to your parents. Now, you can have your parents sign a release through medical records that says they have access to my records. We don't see that happen that often. But that is, if I get a parent that calls and there's no release or the student hasn't given me permission, occasionally a student will say, hey, can you talk to mom? I have some concerns. I'm sharing this with mom and or dad and want them to talk to them. So, but if a parent calls, we don't tell them that the student was there or not unless we have the student's permission. But we can give them general information about what our services are at McKinley. And then a lot of times I'll call the student and say, hey, mom called or dad called. Do you want me to talk to them? Is there something I can help you with? Something going on? But otherwise, everything is confidential and no information is released.
And that confidentiality is for anywhere in the building, not just with health. But the student is in charge of what we share and how we share it and all that. Parents can't call and say, well, this is what I want. We give it. It has to go through the student.
Correct.
We want to remind students that one of the advantages of being here at UIUC and McKinley is that you've already paid for these services through your tuition and fees. And so it's really a great opportunity to take advantage of coming to a facility that is specifically made to support students, to educate students, to start that initial steps into taking care of your own health care. And so if you're listening and you think, maybe I do need to make an appointment or I want to find out more, please do so. Because again, it's about the easiest process you're going to find in the rest of your adult life as you navigate healthcare and checkups and all those sorts of things. It's just a great place to start. The Women's Health Unit, you are specifically here for that unit. There's some floating that happens a little bit, but for other units, nurses move between stations as needed and things like that. The Women's Health Unit, you are busy and you stay there and you focus on that. And so it's really a great resource for students to have and to take advantage of. But as I say it every time kind of flies when we jump into these topics, and we've gone through a lot of it already. There's more to talk about as we go forward or if anybody has any questions. But I just want to thank you all for coming to Carrie, and Christy, thank you for sharing your expertise. Bailey, thank you for being the voice of students. And just thank you so much for all being a part of this podcast today.
Thank you.
as always, we just kind of scratch the surface on a lot of these topics just because we just don't have time to go deep into it. And we could do a podcast as specifically focused on just women's health, and we would have plenty of episodes. So obviously we didn't go super deep into it, but if you have questions, contact us here at Healthy Illini. Contact us at McKinley. We want to help educate. We want to help walk with you on as you're learning how to take care of your own healthcare. Any questions you have, any concerns you have, that's what we're here for. That's why we do what we do, is because we want to support. So really encourage you to do that. We have some resources in the bio, as always, the McKinley contacts, ways to get a hold of people you can talk to, providers you can talk to. But really, I encourage you, if you've not had that initial visit, if you've not come in and started some of those conversations just to find out what you need to be aware of or what you don't know, I really encourage you to reach out to make that step and to get started on that. So thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.